Thank you, Stephen, for that very generous introduction. It's an honor and a delight to receive the Michael Rutter Medal this evening and to give a really short presentation on some of the work that I've done over the last 3 decades, which I think is extending the absolutely brilliant work of Michael Rutter, who we celebrate today through this medal. So I'll begin with the title that I'm going to look at how early childhood education and care support the mental health of children. But I'm going to begin with how I got interested in early education. I'll then introduce the Epsy longitudinal study, which is a large study of children going through their early care experiences and then the rest of their education, looking particularly at the role of pedagogical quality and how in this Epsy study, we showed that pedagogical quality supported mental health. I'll then look at the Children's Center study, which is the second study of the evening, and that will show how Children's Center involvement by families, parents, supported mental health in the families. So the argument is that high quality early years services are important because early education supports mental health in all children, and neighborhood centers such as Sure Start supports parenting and mental health in families. So those are the arguments. Okay, why am I interested in early childcare and education? It begins at Harvard in the 1970s when I was a doctoral student, and Harvard did not have a childcare center. None of the universities had childcare centers. There were a few run by local governments and a few private. So I got together with another student. We raised the money. We got the licenses. We hired the staff. We got the building in the basement of the university church, and we started the Harvard Yard Child Care Center. And here you see 2 children just last year in the Harvard Yard Child Care Center. It's moved location, but it is the same name. It's the same center. Okay, what did I learn? Because I was only doing a doctorate and writing up my thesis, whenever a staff member was ill, I ran the baby room or the toddler room or assisted in the preschool room. So every day I saw children learning. And I decided that although my doctoral thesis was an experimental study, more or less in the lab, of children's problem solving, I wanted to spend the rest of my career studying learning and development in natural environments and thinking of ways that we could improve them, change them, so children's development would be strengthened. Okay, first study is the Effective Preschool, Primary, and Secondary Education Study, Epsy. My co-investigators, Ted Melwish, Pam Salmons, Iram Siraj, and Brenda Taggart. And this is a study that we recruited children when they were 3. You see the little boy on the left. And we wrote our last report when they were 18 years old. And you see these young people in further education. Okay, how did we establish the contribution of early childhood education to development? We used fixed effect multi-level models and longitudinal analyses to identify pathways in development in this nationally representative sample of children, 3,000 children drawn from 141 centers. We sampled 20 children in each of the 141 centers because we wanted to find reliable center effects and to to really know that the Elms Road Playgroup really does foster language in children, but not maths. You have to have quite a few children in each center to have that level of understanding. So we identified the statistical effects of how many months a child attended, the quality, the kind, but in order to look at the effects of early childhood education, we had to control for all the confounding effects of child variables and family variables. So here's a picture of the Epsy design. Children came into our study about the age of 3. and we sampled them in their normal early childhood centers, nursery classes, local authority daycare, private day nurseries, expensive ones run by parents, but we also had a home group of children. And Epsy is the last study in England, well, in the United Kingdom, that can really look at the effect of going to early childhood program compared to staying at home and not going, because we sampled before early childhood education became a free entitlement. And we now have 98.2% of our children attending early childhood. But we, at the turn of the century, were able to sample 3-year-olds who were not yet in early childhood because their parents were not having it. Okay, so I'm going to tell you about the effects of early childhood education on 3 groups of outcomes at the age of 11. English and maths test. These are the national assessments that you all know as parents in May in year 6. And then we looked at social behavioral outcomes. We used the Goodman, which you all will know. And we added some other items and other rating scales for social behavioral outcomes. We looked at self-esteem. So in order to know what's the effect of preschool, which is the little pale blue balloon, we had to control out child factors like child age, child gender, family factors, parent social class, parent salary. We had salary information. We had home learning information. We established the home learning environment between the ages of 3 and 4 by detailed interviews of parents in their homes. So I'm going to show you the effects of preschool, that's the blue balloon, on these outcomes at age 11, having taken account statistically of child factors, family factors, and the home learning environment. Okay, we have assessments, teacher report on hyperactivity, prosocial behavior, antisocial behavior. You all know that. We also added self-regulation, and this was an Epsy measure, which is we put together a few other measures. It has items like this child can move to a new activity on completion of a task. We had some schooly-like measures of can the child self-regulate in the busy classroom. Okay, now I'm going to have just 2 graphs. That's all the data you're going to get. But this is the effect of quality in early childhood education, which we measured by systematic observations, rating scales. I won't go into all the details of reliability and training, but we had them. And it's the effect of global quality, which is called the ECRS-R, and pedagogical quality, which is called the ECRS-E, on children's self-regulation reported by their teachers when they were 11, based, of course, on the teacher observations during them going about their normal life, okay, in year 6 classrooms. So statistically, we have set the home group here. So statistically, the home group has no effect on quality, okay? This is the effect of being in a low-quality center, compared to those children who stayed at home. It's not statistically significant. This is the effect of going to a medium-quality center compared to staying at home. And this is the effect of going to a high-quality center compared to staying at home. This is on global quality. This is on pedagogical quality, but the pattern is more or less the same. And it tells us that if you go to a medium quality or a high quality center, you actually are a better self-regulated child, as reported by your teacher, than if you had gone to a low quality center or if you had stayed at home. Next slide. This is on antisocial behavior, and we did not reverse score this. So antisocial behavior is a bad thing. So the bar chart is going in the opposite direction, but we're looking at the effect of staying at home, going to low quality, medium quality, or high quality on the amount of antisocial behavior that your teacher reports you have. So again, we've statistically put the home group at 0, This is the effect of low quality, which is minus 0.05. This is the effect of medium quality, minus 0.08. Neither of them, by the way, is significantly different from staying at home. However, if you go to a high quality center, you are much less likely to be showing antisocial behavior. So we now go to the next study. Epsy looked at normal children normal children, by which I mean in normal early childhood settings in England. This is a study of children's centers. So we're now looking at provision that's not intended mainly for the children, but is intended for the whole family. We evaluated a group of people, Pam Sammons, James Hall, Maria Evangelou, Rebecca Smees, my colleagues. We evaluated the effect of families' participation in children's centers, but we didn't just look at, is their name on the list? We looked at how often they interacted with the staff at the children's center. Did they attend a parenting program? Did they go to stay and play? Did an outreach worker come into their house to support them with paying their bills? So we're looking at the effect of different kinds of involvement in a children's center on a sample of more than 2,000 families between when the child was aged about 1 till when the child was aged 3. And in this study, and I don't have any graphs because we don't have time, we found that particular kinds of involvement in particular activities in the children's centers, 121 randomly selected children's centers, was associated with parents having improved mental health and improved parenting. So we're now at my very last slide. How does the work that I've reported from Epsy and ECI, study of children going to maintained and private provision, and its effects on their children, and the ECI study, which is the effects of parents and families being involved in family centers, and how do they extend the work of Michael Rutter. So we go back in point 1, Michael Rutter invented the school, well, I think one of the early inventors of the school effectiveness movement, which was to see how certain schools have better outcomes for their intake than other schools. And we used that methodology, more sophisticated because the stats had moved on by the time we were working. But we showed that some centers are better than others at supporting behavioral and social development in children. And Epsy showed not only was going to early childhood good for supporting behavior and mental health, but going to high quality really made a big difference. And I haven't shown you the data, but there was an interaction effect such that quality interacted with mother's education. So if your mother was less educated, quality mattered more. The second finding here is that the family environment, which Michael Rutter taught us about decades ago, shapes children's development. However, our ECI study, the Children's Center evaluation, showed that being involved in your local children's center at certain different activities, certain amounts of time and intensity led to parental mental health and child prosocial behavior. So taken together, we've shown that early childhood programs for children and programs for families can improve mental health of children, mental health of families. And I think this is all in the spirit of Michael Rutter's work. So thank you, ACAMH, for giving me this award. And thank you, Michael Rutter, for inspiring all of us to continue along the lines that he laid out decades ago. Thank you.